I'm very excited about getting the additives out of our foods. I'm very excited about getting corrupt money out of the FDA and the CDC. I actually think this Make America Healthy Again movement could be one of the most significant aspects of this election and Donald Trump being elected is the Make America Healthy Again movement. I think it could change our country forever.
Wow, that's saying quite a bit. National Institutes of Health, RFK, talked about terminating 600 employees there, replacing them with a new group of workers. There is some bipartisan support to that. But I think with a lot of these administration picks, the problem is they are threats to this establishment.
I think that's exactly right. And listen, I think the system needs to be shaken up. Going through COVID, and I think one of the worst parts of COVID, other than the illness and the people who died, was the erosion of trust in public health and in medicine. And that was one of the biggest things that was lost. I think we have a real opportunity here to start from the ground up and rebuild that trust by using data. And that's really all he's saying. He said, show me the data. Let's look at the science.
And it's not just about the care you give your clients, right? There's money involved. There's money involved in a lot of this. I want to play a little clip. This was Trump, Joe Rogan, talking about maybe some pressure that he was getting not to work with RFK Jr.
I would say that, and, I think in many ways they've done a good job. In many ways they've done a bad job. But I would say that the Big Pharma wasn't thrilled when they heard that, I've actually always gotten along very well with him.
Wasn't thrilled. Yesterday, the stocks started reacting, plunging when this announcement was made. Are you surprised?
Well, I'm not surprised that the market's reacting. I think we have to do this. There's a revolving door, and a lot of people don't know this. And prior to COVID, when I started to dig into this stuff myself, I didn't realize there's a revolving door between big pharma and the government agencies like the CDC and the FDA. You have executives who work for the government or a pharmaceutical industry, and they go back and forth. And that's not good because there's big money lobbying going on, and there's a disincentive to actually follow the science because the main goal is to make money. And that's not the way healthcare should be. Because right now we have sick care instead of healthcare. Sick care means we only make money if people are sick. There's no incentive to keep healthy people healthy. That's what I'm all about.